Today I am going to talk to you regarding 5 things that you need to remember before going to get treatment in a healthcare facility or in a hospital. So be with me till the end of this video to know the 5 things that a patient needs to remember before going to get a treatment. Hello, welcome to Dr. Akin Clicks, and I am Dr. Akin. The 5 things that you need to remember before going for a treatment, one by one I am going to tell here, so please don't skip the video and watch till the end. The number 1 point that needs to be remembered before choosing to get a treatment is you have to decide that what kind of hospital you are going to get yourself treated, whether it is going to be a private hospital, that is a corporate hospital, or a government health facility. In corporate hospital, the rush is not that much and the things can move very fast. Treatment and procedures can be done very fast, but in government health facility, in government hospitals, the rates are subsidized, the treatments are subsidized, and few treatments are free also. Therefore, there will be heavy rush of patients in government healthcare facilities, and there will be a long waiting queue to see a doctor in the outpatient office, and there will also be a long waiting list queue for any intervention or surgical procedures. But in the government healthcare facility, the treatments are subsidized much cheaper than the corporate healthcare facility. The number 2 point that you have to remember before going for treatment in hospital is that you have to look up at the list of procedures and treatment cost. Basically, you have to look up at the cost of treatment in the hospitals. In the corporate or private hospitals, the cost will be high because there is no subsidized treatment. There is upended facilities. You will get treatment like a 5-star hotel, so obviously the costs will be high. Whereas in government healthcare facilities, since the rates are subsidized, some of the treatments are free, so you can spend lesser money than the corporate hospital in the government healthcare facilities. In India and in many developing countries, the healthcare spending for the citizens is mostly from out-of-pocket spending. Therefore, before going for a treatment in hospital, you have to look at the cost that is involved, the cost that will be there for you to get the treatment. The number 3 points that needs to be remembered is the convenience and compliance. When I say convenient and compliance in number 3 is that if your treatment is going to be long duration and you are advised by doctor to follow up regularly, say once in a month or once in 3 months or once in 6 months, is it convenient for you to follow up with that hospital? Basically, you have to select a hospital in which it is convenient for you to get treatment. It should be easily accessible to you. It should be easily accessible to you when you need in emergency situation. If you have the means and ways, and if you are a well-to-do person, however far the hospital may be in any part of the world, you can get there for treatment. But for a common citizen whose resources are meager, whose resources, financial resources are limited, you have to look at the resources and see whether it will be convenient in case of urgent need to meet the doctor. And talking about compliance, you have to also remember whether I am able to comply with the doctor's advice. When the doctors say come after 3 months, come after 1 year, come after 2 months, is it possible for you to comply with the doctor's advice? Because to complete the treatment, to make the treatment successful, convenient to reach the place of treatment, and the compliance of the doctor's order is very, very essential. And the number 4 point which needs to be remembered is that whether you have pre-existing diseases. If you have any other comorbidity related to this present illness, you have to inform the doctor, and you have to inform the doctor so that necessary precautions can be taken during the treatment of the already pre-existing diseases. And the number 5 point that one has to remember when you are going for a treatment or during the treatment, you have to be proactive as a patient. Any doubt which you have to inquire from the treating doctor or treating team. And if you are in any doubt, you have to ask by yourselves and clarify the doubts, get answers for those doubts, so that your treatment can be successful and can be smooth without any interruption. Example, when the doctor says you take this medicine with the food, if you are in doubt, you have to ask the doctor whether you have to take before food, with the food, or after the food. So a proactive patient will always be very, very helpful for the treatment to be completed properly and for the success of the treatment. So remember all these 5 points. There are many other points that needs to be taken care before a patient goes for treatment in a hospital, and also many points that needs to be remembered which a patient has to remember during the course of treatment. So if you like this video, please like, and if you are visiting my channel for the first time, please subscribe, press the bell icon so that whenever I upload a new video, you will get the latest notifications on health and health issues. Thank you for watching this video.